Good afternoon, everyone. I'm so glad that you could join us today on Global FPIES Day, and thank you for tuning in to learn a bit more about support groups and how you can create one in your community and how they can be helpful for your own family and for other families and individuals affected by FPIES, which of course is food protein-induced enterocolitis syndrome. My name is Amanda LaFew. I am one of the co-founders and co-directors at the FPIES Foundation, and I will be leading the webinar today. So again, thanks for joining me, and let's get started. Just a little bit of background. As I said, I'm one of the co-founders of the foundation, and I also hold positions of co-director and medical liaison. I live in Western Massachusetts with my husband and 2 children. Prior to working with the FPIES Foundation, I facilitated multiple support groups for a wide range of ages and diagnostic populations. As a music therapist, I've witnessed firsthand the power of creating community and relationship building through these support groups. And as a mother of 2 children growing up with FPIES, now ages 9 and 12, they grow up so fast, I fully understand the value of finding community when coping with a child or with a difficult diagnosis for myself and for my daughters. So just briefly, we're going to go over what we will learn today. We're going to first start out, of course, with what is a support group. We're going to look at what types of support groups are there, and of course this list is not exhaustive, but it should give you a good place to start. We also want to look at how do I create a support group, and of course how do we keep our support group active and effective. We want to make sure that our support groups keep going so that they can benefit our own families, but also the community at large. So you may have been in a support group before, or you may yourself have led support groups, but just a general overview. What is a support group? This is a group of individuals who meet on a regular basis, and they have the shared goal of providing peer support to one another via conversations and or other activities. Support groups can be based around a specific theme. Perhaps your support group exists to help provide stress management or to, look at different coping strategies and learn how to use them in your daily life. Or it could be designed to simply support those affected by similar experiences. And as we're discussing today, this could be a common medical diagnosis like FPIES. So support isn't one size fits all. People have different unique needs, so it makes sense that support groups can be designed in different ways based on the needs and interests of that group's members. And just a little note too, those needs can change over time as well. And just an example, if you start a support group for children affected by FPIES, as those children get older, they're going to have different obstacles or different concerns, perhaps than they did a year or several years before. And even though we do not change maybe quite as rapidly as our children, adults' needs can change as well. So it's important to recognize that, perhaps the support group style that you start out with initially, that can change over time, and that's okay. So just something to keep in mind as you move forward. So let's get started talking about different types of support groups. The first type of support group we're going to start talking about is simply called model number 1. And you can think of it as parent to parent, or in the case of older individuals diagnosed with FPIES, you can think of it as patient to patient. So in a parent to parent support group model, this is a more casual group, and the main goal is to focus on providing a family support network. Once established, the parents in this group may collectively decide whether or not to provide a specific goal-based focus. And again, like I mentioned before, this focus can change over time. So it is also significant to mention that a facilitator is not necessary for this group, but you could always, if your group prefers, you could always invite a facilitator on board. And again, in the instance that the support group is made up of individuals who they themselves have an FPIES diagnosis, in the case of older children, teens, or adults, it's very similar to the idea of parent to parent. So with patient to patient, this style of support group, again, it's a casual group that involves individuals all affected by the same or perhaps a similar diagnoses. So for instance, maybe you are an adult or a teenager affected by an FPIES diagnosis, but there may not be a lot of people in your peer group that live near to you that also share this diagnosis. So perhaps your support group might include, other individuals affected by food allergies, or perhaps you might have a support group set up for people living with chronic conditions, or, perhaps gastrointestinal conditions, whatever your classification is. You would want to think of it in terms of, a group of people that have similarities among their diagnoses or their experience. So again, once it's established, group members can determine their focus if desired, or that can change week to week. And again, generally a facilitator is not needed. Moving on to the second type of support group, we want to look at model number 2, and this would be a group providing additional therapeutic support. So perhaps a group that is facilitator-led, so parents or patients with therapeutic support. And in this case, a mental health professional, so a counselor, a social worker, a psychologist, they could provide additional help with coping skills development, stress management strategies, relaxation techniques, and so forth. When you're seeking out a mental health professional, you might want to seek those out that already have a family therapy or pediatric therapy background, if this is a group designed around those caring for children or infants affected by FPIES. Now, if you're a group of adults or teenagers that are affected by FPIES, you might want to seek out a therapist that has a background working with individuals living with chronic conditions, chronic illness, or even food allergies. So you want to make sure that your facilitator kind of has a general idea or experience level of working with individuals that have similar conditions. It may also be helpful for the professional to have experience already working with people individually that are coping with chronic illness. And you can determine this by going to some websites to search for mental health professionals. A lot of times in their biography, it'll tell you, what their experiences are, but also you can, of course, call or email different professionals and just kind of get a general feel of what their background is. So moving on to model number 3, looking at patients with medical support or parents with medical support. And this is just a little bit different from mental health professional. They, of course, are medical professionals, but here we're talking more about a physician or a nurse that works in clinic and specializes in either FPIES or very similar conditions. So a group wishing to have more information and support regarding the medical aspects of their own or their child's care, that's the group that would be interested in a patient with medical support or parents with medical support set up for a support group. Group members must be aware of limitations. This is so important. It's easy to go down that slippery slope and, you see this medical professional here at your support group meeting, for helping to facilitate, and it's very tempting to ask for very specific medical advice. But that's not what they're there for. Individuals or families might incorrectly assume that having a medical professional present allows for person-specific diagnostic and management information to be offered, but this is not the case. You have invited this person to be a facilitator of your group because you are wanting more generalized information and support regarding the medical aspects of this diagnosis. So if, as a group member or as the person organizing the group, you want to be sure that all members are aware of what the medical professional may ethically discuss. And it can be helpful for the medical professional themselves to dedicate a session or perhaps a set period of time to explaining limitations and setting expectations or boundaries. And it most certainly cannot hurt to have some kind of disclaimer or brief explanation of this in writing for group members. So the next type of support group we're going to look at, model number 4, kind of piggybacks on what we just spoke about. And with this type of support group, educational priorities really sums it up. So you could use this in combination with many of the previously described models if you want your group to provide information and education regarding the diagnosis, in this case FPIES, and its daily management as its primary objective. So group sessions might include in-services, guest speakers, hospital tours, and so on. And other goals may be addressed, but educational goals really will remain the primary focus. So this is something that, in your initial meetings as a group, as you're, setting the ground rules, as you're getting to know each other, you might want to map out what your educational priorities are and kind of plan ahead in that way, especially if you are going to be inviting guest speakers, or if you're wanting to take hospital tours or whatever you're wanting to do. That takes planning, and it can take time to kind of set these things up. So mapping things out in advance and having really a clear plan of how you want to go about this can be very helpful. And just an example of some of the things that you might want to look at is, perhaps having guest speakers from different disciplines, such as an allergist immunologist, or perhaps a gastroenterologist, or a registered dietitian, all that are familiar with FPIES and the different challenges that individuals diagnosed with FPIES might face. When you're considering a hospital tour or clinical tours, perhaps this is something you're looking at if you're discussing different types of tests that an individual affected by FPIES might need to undergo, such as an endoscopy. And perhaps your group members feel like it would be a benefit to be able to tour or get some more information about, what's involved in visiting the endoscopy unit at the hospital. So those are just some examples. And of course, you can come up with your own ideas from there. And again, you may also want to look at the mental health side of things when you're looking at your in-services or guest speakers as well, and perhaps inviting someone to, work with you on stress management, perhaps guided imagery or yoga or whatever your group members feel like might be helpful, in order to better support their coping with this diagnosis of FPIES. And again, like I said, other goals may be addressed, but educational goals are the primary focus of this group. And as we mentioned in the other areas before, of course, this can change over time. A fifth type of support group you might choose could be caring for caregivers. And again, you could use this in combination with any of the previously described models. And what this group model really does is it provides opportunities for improved coping skills development and stress management strategies, which are directed at the individuals caring for the person affected by FPIES. Having a mental health professional act as a facilitator, or having frequent guest facilitators from varying mental health professions may be most helpful in achieving this group goal. Now, when you're looking at a support group of teens or adults diagnosed with FPIES, you could actually approach this style from a self-care perspective, emphasizing the need for appropriate self-care in the face of living with a chronic condition. So now that we've looked at the different models, we want to discuss a little bit about how you go about creating your group. You may have already been in discussion with the people you're planning to have in your group, and it may come together very easily, or it may be a process that takes a little bit of time. It just really depends. So you could create your group or gather your members before determining which support group model to use, or vice versa. Perhaps you start out with the style of support group you want to do in mind, or perhaps you want to wait and see what all the individuals in the group kind of feel would benefit them most, and you vote on it from there. So where do you find members? Like I said, you may already know some people that you've talked about getting together and forming a support group, and there you go. But if you don't already have members for your group, you could go about word of mouth. Perhaps you belong to an online forum of individuals who are living with this condition or caring for someone who is. You might want to look around there and see if anybody is interested. You can also spread the word to practitioners who see patients with this condition. You could even post notices on community boards with your contact information that you feel comfortable sharing. You want to be clear about basic expectations when spreading the word. So for instance, you want to be very clear that this group is not for the purpose of offering medical and/or diagnostic advice. So as you're creating materials to share, to kind of spread the word, it can't hurt to have another person kind of look over what you have and just review and make sure that you have all the necessary information provided. So now you've picked your format. You are gathering members for your group. So what we're going to look at now is for tips for growing your group. So once you've determined your model and you have your intended goals in mind, there are some things that you want to consider. So where's your group going to meet? Are you going to be meeting virtually? Now there are so many virtual platforms available to you online, and that in and of itself is something that you would want to research independently just to kind of see which platform you might want to use. Or perhaps you feel it would be better to meet in person. Whether you're virtual or in person, you want to make sure that there is a private space. You might be talking about sensitive information, and people want to feel safe and confident that they can share and be supported in a private area. So the next thing you want to consider is when and how often will your group meet. Perhaps maybe you're once a month, perhaps it's once a week. It's really going to depend on the availability of your members, what everybody's work schedule is or family schedule. So you kind of want to hash out those details. And finally, who will your group involve? If your group is parents of children who are affected by FPIES, are you going to allow children to be present? Or maybe perhaps there will be one group a month where you also have a play group for your kids. I don't know. It's just something that you need to discuss and figure out in advance. You also need to think about, will family members or partners be permitted, especially in the example of adults affected by FPIES. Do you want to invite, partners to be present for all the meetings? Is that something that, perhaps you might have a group here or there where you want to invite family members or partners, but you might not want them there all the time? Those are some things that you need to take into consideration. And as we mentioned earlier, will there be guest speakers? How often? Who will they be? And finally, will there be a facilitator? And if there will be a regular guest speaker or regular facilitator, that's also going to impact when and how often will the group meet. So those are just some basic concepts that you need to kind of keep in mind as you're establishing your group. So just some things for your consideration. As you're growing your group, you want to, of course, establish a way to contact everyone, and you want to discuss whether or not social events might be included in your support group strategy. So you want to make sure that you create a contact list or a phone or email tree and establish clear ways to get in touch with one another in the event of emergencies or just simply for scheduling purposes. And you want to make sure that everyone is clear on what ways to reach out to one another. Your group may also wish to create periodic social events outside of the support group framework. And this could include awareness events, fundraisers for related nonprofits, or simply family meetups or play dates. These can all help to continue fostering a sense of community among members. And they can be a really great way for feeling connected in your group. Another thing to consider is group assessment. It might sound a little odd, but you want to make sure your group is being effective and, really achieving the goals that you have. So periodically checking in with members to determine how effective your support group is being, it can really help to not only determine new or emerging needs of members, but it can also help members to take ownership of the group, which in turn helps to foster more community building. Simple surveys offered periodically will do the job. Just having something in place that people can periodically check in and fill out, it can really help you to continue developing your group in a healthy way. Consistency is so important. Support groups can be intimidating to some people, and because you're letting someone else in, you're trusting other people are going to be there for you and you're going to be there for them. So part of that is, being consistent and making sure that you're doing what, you set out to do and that you're being there for each other. So in providing a supportive environment for those living with an at times unpredictable diagnosis, consistency really is key. You want to keep the group schedule, expectations, and ground rules consistent, and this is going to help to foster trust and relationship building. True foundations reaching your goal of providing meaningful support. And of course, confidentiality goes hand in hand with that relationship building and fostering trust. Confidentiality is essential in order to establish this trust among group members and in order to truly create a safe space for members to share their thoughts and experiences. You want to be sure to include clear descriptions of what is expected of group members when you go about establishing ground rules. And that leads us to ground rules. So I'm sure we all remember back in school or, maybe clubs that we might have belonged to when we were kids. Every now and then you get those teachers or facilitators that have you create the rules for the classroom and, they write it down on the blackboard, what everybody thinks are important rules to, maintain to keep the class running. Well, this is pretty similar. You want to have ground rules established by your group. And in that, you're establishing expectations among group members. So why would you do this? We're all responsible individuals. Well, discussions and subject matter, they can be really emotionally charged sometimes. So group rules can help to ensure a safe, non-threatening therapeutic environment where members can feel more comfortable. And as you're developing those ground rules, you want to consider some key points. Respect for others, confidentiality, I can't say it enough, taking turns, yes, even adults do forget, and the group's routine. You also really need to solicit input from all members in order to arrive at a reasonable list of ground rules and make sure everybody agrees to them, whether it's verbally or you want everyone to have a copy of the written ground rules. You just want to make sure that everybody's on the same page. So it's not fun to discuss, but what if someone violates the group rules? You want to be sure to have a clear process for handling potential violations of the rules so that members know what to expect. And again, this policy should be formulated by group members in the initial meeting. So everybody should be on the same page and decide, how to go about things if there is a violation of the group rules. It's unlikely this will happen, but having a plan in place can really help group members better navigate potentially awkward situations. So just to review some key points, support groups can be really a great way to create community and provide interpersonal support for individuals affected by FPIES and or their caregivers. Different people have different needs, so when you're going about setting up your support group, exploring a variety of support group models can really help you and your group determine what's the best fit. And again, as I said before, this might change over time, and that's okay. It's important to be open to that and to know that, it will best suit your needs as you go on if you are open to change, if need be. Whether virtual or in person, group members can be found in a variety of places. Once your support group is ready to get started, you want to set those ground rules, and they can really help you to create an enhanced sense of security and foster a closer community among your members. If you have any questions, if you have any comments, or you want to share additional resources, I hope that you'll reach out to me and at a.lafute@thefpiesfoundation.org. And though the information in this webinar is comprehensive, it is not exhaustive. There are happily several resources online and in print that cover the ins and outs of support groups. And I just put a few down here to get you started, but really there is an endless supply. So don't hesitate to, research and explore as you are setting up your support groups, but also as you're continuing with your support groups, because you can always hone what you're doing, and make it more workable for your group members as time goes on. So there's first the support group manual, which is a session-by-session guide, and that's by author Harriet Sarnoff-Schiff. Next, we have Effective Support Groups by author James E. Miller. And so for some online resources, we have a support group manual from the National Parkinson's Foundation. This is a PDF. Although this is directed at the community affected by Parkinson's disease, there are some really great tips and resources that can be applicable to a variety of settings and groups. So if you want to check it out, I included the link here on this slide. And then we've got the Mental Health America's Guide for Peer Support, and I have the link there. That's also a PDF. Don't hesitate to look at resources that are for support groups with people affected by other diagnoses. There's so many commonalities in the needs that people coping with chronic illness face, and really we shouldn't hesitate to learn from one another. So don't hesitate to, reach out and look for that information online. It can be really helpful. So again, thank you for watching our presentation today, and we look forward to hearing from you about the progress that you have with your own support groups in your communities, and if you have any questions or request any resources from us. And again, please be sure to check out additional resources at fpiesfoundation.org and fpiesday.com. And I hope you've learned a lot today. Thanks so much. Have a great day.